Hi everyone, and welcome to the 42nd episode of Battles and Voices. I'm Ladika, and I'm the founder and host.
And I'm Camden, and I'm the co-host.
Battles and Voices allows people with different experiences in healthcare to share their stories.
Now, please welcome our guest, Maria.
Hi everyone, I'm Maria. Nice to meet you guys. Thanks for having me.
Of course.
Maria, thank you so much for being a part of this episode. It means so much to us that you'll be one of our guests today on Battles and Voices. Feel free to kind of introduce yourself and share some things about yourself as well.
Okay, I was a medical assistant for 10 years before I transitioned to nursing, and I am now entering my second year of medical school. So I went through like a really untraditional path. I currently go to med school here in Grenada at St. George's, and I love it. I think it was worth the long run.
Perfect. And can you tell us a little bit about what inspired you to go into healthcare and what you're doing currently?
Yep. So I've always been drawn to healthcare because I love the combination of science, problem solving, and like the human connection of it. I started working as a medical assistant when I was 17 years old. And then from there, I like worked as a medical assistant to put myself through college. Then I went the nursing route to get like a little bit more experience and more responsibility hands on. And then eventually I finally doing what I wanted to do, which was go into medicine. And I'm about to enter my second year. So everything's been going really well.
That's amazing. Congratulations again for taking that huge step.
Thank
So,
you.
what was the biggest adjustment you faced while transitioning from being a medical assistant to nursing and then later, of course, to medical school?
I think it would definitely be the level of responsibility. When I first started working, I would just go in and like mindlessly do like my vitals, do kind of like whatever was expected of me without asking like why. When I transitioned into nursing, like my critical thinking started to develop more, and I started asking like, why am I doing this? Why am I giving this? What are the effects of that? And I think that really has helped me transition further into like a medical student because as a future doctor, like I have to think about everything and like not just do something but like the potential long-term effects. So it's just that level of responsibility and continuing to develop that critical thinking that was the biggest adjustment.
That's amazing to hear. And how did your experience as a physician's assistant shape the kind of physician that you hope to become?
I think that working in a supportive role, it taught me the importance of like teamwork, communication, knowing when to ask for help, like starting from the bottom and then kind of like working my way up. It's been really interesting to kind of see like everyone's role and the importance of it because everyone's role is so freaking important. And I think I want to go into ER medicine because it's so team based and everyone like with all of like their roles, like the respiratory therapists, like the nurses, even like the people that go and like register the patients with their insurance, they play like such a critical role. And I think that teamwork is what really attracts me to the emergency medicine aspect of it.
Same here as well. So, can you describe the moment in the emergency room where you knew that you're on the right career path, besides working in a team-based environment?
Yeah, I think what really did it for me was seeing we had like a patient that came in and they were like really critical. And the way that we were able to like quickly stabilize them, everyone followed their role. We were able to get that patient from like being unstable to stabilizing them enough to bring them up to the ICU and just having that responsibility, like I want to be able to care for people like in their worst times, and I want to be able to make an impact right away versus like other specialties where it's more like over time. But like with emergency medicine, it's more like right away, it's like life changing.
That's amazing to hear. And I know we didn't mention this earlier, but you're a first gen student. And as a first gen student, what challenges have you faced in medical education and how have you been able to overcome them?
I think like the biggest challenges is like I was the first person in my family to go to college, so I couldn't really go to like my parents and ask them for like advice or anything. So I didn't have like a clear roadmap, which is kind of like why my journey like took so long to like begin. But the ways that I overcame them was like talking to professors. Social media started happening, so I started reaching out to people, like asking, like, "Hey, how are you doing this? Like, do you have any tips?" Like, I don't really know much about it, so like networking for sure, finding like mentors, um, trying to build like a support system and applying for scholarships too because I had no idea how to like finance like school, like all the tests associated, like the MCAT. So honestly, just networking and reaching out to people.
Yeah, I definitely agree as well. My parents did all their schooling in India, so like I'm the only child, and so like this is my senior year, and I'm applying to colleges, so many colleges, and it's just so like weird because I can't ask them how to do the FAFSA and all that.
Exactly.
And yeah, so you definitely do need a support system. So yeah, I'm glad
I
that you over. Oh, sorry, go ahead.
No, you're good. Keep talking, and I'll talk after you.
But yeah, I was just gonna end off and say how persistent you were, and I'm so glad that you were able to overcome those challenges.
Thank you.
You're welcome.
I always love the community of like first gen students because you find like so many people that you can obviously like relate to about like the pressures that you may feel and like obviously talking about the persistent that you want to obviously keep going. Sorry, I thought I heard something outside my room, y'all. Um, but like even I'm a first gen student, like my parents, well, one of my parents attended college, but not like it's weird. But like I'm not considered like I'm considered first gen because she only went to like a an associate's like degree. She didn't go higher.
Hmm.
Um, but like I can't even communicate to her about FAFSA because she never even had the opportunity to do FAFSA at her community college that she attended. And even like trying to get advice about again like advice about like college life or even what I should do about a dorm or anything is obviously like she's like I don't know, just ask a friend. I'm like, oh, okay, but like I just love the community of like obviously reaching out to like other first gen students who already are at their first year college and just hearing it from them, and it brings so much comfort to me to know that I have somebody that I can relate to who's already a step ahead of me and can tell me what to do.
Yeah, I love networking and like communities like this. Like, I will always be like a mentor. Like, anything, ask me, please. Like, I want to help people.
Oh my gosh.
So, do you have any stress relieving techniques that you use when you aren't having the very best day at work, or even when you go through difficult times at work, too?
I think like when I'm at work, I would try to take a break and just get a coffee and just kind of sit down and try to like take a couple of minutes and like relax. Outside of that, I do try to be more active and like exercise more or see if I can spend like quality time with like family or friends. And I wish I could travel more, but with school and everything, I haven't been able to as much, but hopefully in the future.
I hope that you get to do that in the future too. And I love those relieving activities too, like just working out, getting like a good little gym, even like 20 minutes. I love just doing that. And sometimes I've mixed school while being on the treadmill too. I don't know what I ever pulled at, but but I relate to you with the skills, the stress relieving activities. So I know we talked about the emergency room earlier. So what skills do you believe are most important for someone while working in emergency medicine?
I would probably say you have to be adaptable because you never know what's going to come your way. You have to be like a little bit emotionally resilient because you're going to see all kinds of things. You can have a good day or like a bad day. Strong communication with your team and the ability to stay calm under pressure. Also knowing when you need help. Like you're never gonna know everything, and like every day is so different. Like you're gonna learn new skills, and I think just knowing when to ask for help is also really important.
Definitely agree with you. So I know we talked a little bit about social media and networking and all that. So how do you hope to use your platform on social media to inspire countless of future healthcare professionals?
I hope to show people that there's like no linear path into like medicine. Everyone's path looks like a little bit different, especially like if you're first generation or like non-traditional, and that like it's never too late to start. Like I started med school when I was 29, which like when I was first starting undergrad, I was like, oh, I'm gonna be like med school in a couple years. It didn't happen like that, and I didn't give up on my dream because this is what I really wanted to do. So I hope to like show people that it's never too late, and you can always like go into different professions. Like I did medical assistant, nursing, medicine. Everyone's journey looks different, and if you really want it, just keep going. You'll get there eventually.
That's so beautiful to hear, and I'm glad you never gave up. Now, is there someone in particular that has given you the motivation to come this far?
I think what motivates me is I want to be the kind of person that's there for their patients on their worst day. I know it's like a lot of responsibility, but it really motivates me to do well in school and gain the skills that I need. Also, like looking back, I like my younger self. Like as a first gen, I never thought I'd be where I am today. So like continuing to work hard to impress that little girl who had no idea what her life would turn into.
That's so beautiful. You have like tears forming in my eyes right now. I don't know why I'm so emotional today. I watched like a really good movie today, and I guess I'm so emotional. But yeah.
What'd you watch?
Sorry, what did you say?
What
What
did you
movie did you
watch?
watch?
Oh, it was this new movie on Netflix, People We Meet
The
on
people,
Vacation. Yeah.
I'm
It
gonna
was
watch it
actually,
tonight.
it was so good. It literally, I was like tearing up, but
Okay, I'll watch
I
it too
read the
then.
book. I read the
definitely.
book, but I'm excited to see the movie. I'm gonna watch it tonight now.
We're all gonna watch it tonight.
We're just gonna stream it all together, huh?
Definitely, yeah. So to wrap things up, do you have any advice to give to any of the members in the audience listening now, hoping to reach this particular stage that you're in currently?
Yeah, I would just say don't compare your timeline to anybody else's. Everyone's journey is a little bit different. Ask for help. Don't be afraid to reach out. Like as corny as it sounds, you miss 100% of the opportunities you don't take, right? So like message that person that you want to have like as a mentor. If you have any questions, ask like physicians, PAs, NPs, whatever that you want to shadow them. Like people will most likely say yes, like 95% of the time. And lastly, just be consistent. Like discipline is all you need and the motivation to keep going. But you'll eventually get to wherever you want to, even if it takes a long time.
That is so beautiful, and thank you for that wonderful advice. And lastly, thank you for sharing your path through medicine and your future goals.
Thank you guys for having me.
Of
Thank
course.
you. It was truly inspiring to hear about all the transitions and phases of the healthcare journey that you've gone through and about your social media platform as well.
Now, to everyone tuning in, thank you so much for joining us on today's episode of Vitals and Voicement. Your engagement and loyalty means the world to us.
If you enjoy this conversation, then be sure to follow, share, and stay tuned for more episodes on Battles and Voices.
We'll see you next time.